Disclosures for this and all episodes in this series can be found on the podcast series destination page, located on education.webmd.com. The following presentation is copyrighted by WebMD Education. No use, broadcast, or recording of this presentation or any part thereof is permitted without the written authorization of WebMD Education. The following podcast was developed through a strategic collaboration with the National Alliance on Mental Illness, supported by an independent educational grant from Takeda.
Hello, my name is Dr. Rakesh Jain, and I'm a clinical professor of psychiatry at Texas Tech University School of Medicine in Permian Basin. And I would like to welcome you to this podcast episode, What to Know About Depression and Your Sex Life. This is part of the 6-episode podcast series, What to Know About Depression. Today, I'm speaking with Adam. Adam, you and I have spoken before, but for our listeners, can you tell me a little bit about yourself and your experiences with depression, perhaps starting with when you were first diagnosed?
Sure. And I just want to say thank you for having me today. I am always happy to be able to help and tell my story and hope someone can listen and learn. So my family has a history of mental health conditions. It's something that runs from both sides. But when I was a child, I didn't really exhibit any symptoms. A lot of time was focused on my younger brother who has autism. So I was learning sort of a lot while watching him and seeing what he was going through. But as I got older, around the time I was hitting late middle school to early high school, I started exhibiting signs of depression. My mood was swinging back and forth. There would just be days that or days or even weeks that I was just completely low and down. And both myself and my parents were like, well, is this something that is actually depression, or is it just like hormones and just becoming a teenager? Because most, if not every teenager has those mood swings, So after a while, my parents and I decided that we would go to a doctor, and I ended up getting diagnosed with major depressive disorder, or MDD, when I was 14 years old. I was a little bit hesitant about sort of admitting that I had something wrong with me, because, we unfortunately live in such a world where having any kind of non-neurotypical anything is heavily stigmatized. So it was a little bit jarring, but I was prescribed medication, but I just didn't stick with it. It was half I didn't want to admit. And, I was a teenager. It's like, I'm just 14, I'll figure this out myself. That's just sort of how that went. But as we learned as we went on, not taking my medication was a terrible idea, because my crashes got worse, my irritability got worse, and it made high school even harder than high school already is, because it just gave me this really aggressive feeling of just worthlessness, and I didn't know how I was going to get out of it.
Adam, thank you so much for sharing that story. And as I reflect back on when I was 14 years old, that was such a tumultuous time. And I can imagine it took a while for you and your parents to kind of parse apart the disorder from just being a teenager. I'm very glad you started the journey, but I understand why adherence was a little bit of a problem. And we certainly will be talking about that as well, Adam. And today we're going to specifically talk about major depressive disorder, or MDD. And we often refer to that commonly in society as depression. And this is one of the most common mental health conditions in the United States. And up to 25% of adults, Adam, can have depression at some point. And this depression can also happen in teens, as it happened in your case. And I'm a child and adolescent psychiatrist as well. And sadly, I often see it in children too. This disorder, just like in your family, Adam, can run in families. And it can, however, also affect people who do not have a family history. And in some people, they have one depressive episode and they're done with it. And others, they have several episodes during their lifetime. So just to remind our listeners, depression is a mood disorder that causes feelings of sadness that won't go away, a loss of interest in things that you normally enjoy, and many other symptoms that could be called emotional and physical. And to be called a major depressive episode, most folks have these symptoms at least for 2 weeks, most of the days in that week. And the biggest problem with MDD or depression isn't that it's just a mood disorder. It's a mood disorder that leads to so many challenges. So Adam, I'm actually kind of curious. Once you kind of ended your story at 14, could you pick it up there and tell us what happened as you got older?
So we ended up making it through high school. It was definitely a bumpy, rocky road. But, when you're a kid, you're still at home. You have the same sort of stable foundation around you. So while you might be experiencing something, everything around you is kind of the same. So I guess you can sort of just latch on to that while you're at home. But once I moved out and went to college is when everything started spiraling back again, because, you're in a new environment and outside of the normal stresses of just moving out for your first time, going to college, meeting all these new people, this, that, and the other thing. On top of that, I was trying to manage my depression without medication. So I'd say probably a week and a half into my first college semester, I found a different doctor and talked to them about my depression, and they gave me a new medication to try. The positive with that medication is that it really did help stabilize my mood, but it ended up giving me some pretty jarring side effects. I didn't actually realize at the time they were side effects from the medication. I didn't know if it was something caused by stress. I didn't know if I was just hitting some kind of weird late physical thing within my body. I had no idea. So this was about when I was 19 years old. I started experiencing sexual issues, which in general are just jarring. But at that time, when you're in college and everything, there's a lot of layers that kind of get packed on top of that. I noticed that I was able to get an erection, but it was near, if not fully impossible, to climax or have an orgasm. And it was shocking. I didn't know if it was a lack of experience. I didn't know if it was dealing with the environment around me, but it was shocking. I had no idea what was going on. And I had a girlfriend in college, but I didn't have anything else really to compare it to. So I didn't know if it was dealing directly with my depression or just all of the other extenuating circumstances around me.
Wow. Thank you, Adam, for being so very open about an issue that we simply don't talk about enough in society. And your point about, is this a symptom of my depression or is it something else, is a really important one that we should spend some time examining. Truly, there's a wide variety of symptoms that one can have with depression. And of course, the main symptoms of depression are depressed mood or loss of interest. But many people also report tiredness or lack of energy or sluggishness and sleep problems and weight problems. And of course, as a college student, having concentration problems or memory problems would have been challenging. And in some people, sexual difficulties can be part of the depression. So it's a pretty challenging scenario, and it kind of hurts my heart that as a 19-year-old who is just kind of, developing your own place in this world, you are having to deal with this. I feel really bad about that. And that's why I'm going to ask you a couple of questions to help me better understand that. So the question about, is this depression or is it your medication, is an important one, even I, as a clinician, am often dealing with. And I think our listeners would be well advised to remember that sexual difficulties can be both a symptom of depression, but they can also be a side effect of some medications used to treat depression. So it's a pretty complex thing. So it can be bidirectional, it can be two-way challenge, and very many patients don't report it to their clinicians, and that's a bit of a challenge. So Adam, tell me this, in your case, was it you telling the clinician about these sexual difficulties, or was it the clinician asking you about these sexual difficulties?
I was actually the one who brought it up. I guess, depending on how you look at it, in this case, it was a good thing. I didn't feel like it really would have served me in any positive way to kind of beat around the bush. I luckily was just like, hey, this is what's going on in my life. I just need to know if this is something going on with this, with what I'm dealing with. When I had depression crashes, obviously it took a toll on my sex drive, but it killed my drive for everything. Like I wasn't really eating. I had no desire to do even things I've enjoyed since I was a kid. The sexual issues were really difficult. It made me feel very embarrassed, incredibly insecure, and just less, I guess is the best way to describe it. It took a stab at my manhood, and it made it incredibly difficult to have a healthy relationship. The whole thing in general was just really difficult to deal with overall. So luckily, in one of my wiser decisions in my life, I talked to my doctor, and they were very informative about what sexual issues can be happening, and that it's really common for not only people dealing with depression, but people on medication for depression. So after we talked, my doctor ended up switching me to a different medication. And luckily, this was the sweet spot that dealt with both the depression issues and also eliminated the sexual issues that I was experiencing.
Wow, Adam, there's so much that you said that I would love to unpack. But the first thing I would like to do is to thank you, both on my behalf, but also the listeners, in being so open about how this journey can be so complicated. So depression brings with it sexual difficulties, and one goes to see a doctor or a healthcare provider, takes a medication, and perhaps if there are sexual difficulties, it just adds to the challenges, adds to the trouble. And I truly admire that you did not take this issue lightly, that you brought it up to your clinician, and bring it up to your clinician obviously led to a solution. And I suspect as people are listening to you talk today, Adam, they're probably finding in them the same desire that, hey, I have a right to lead a full life, and that includes my sexual life. And if there are any challenges, they too should do what you did, Adam, which is to bring it up to your clinician. So that brings to mind a few more things that I wanted you to reflect on. But one more time, reminding our audience, living with depression is hard. And sometimes the treatment for depression, say an antidepressant, can have side effects. But the best way to deal with that is please don't suffer with those side effects by yourself. Do exactly what Adam did, which is be proactive, bring it up to the clinician. Your clinician very likely has specialized training in understanding and differentiating if the sexual side effects are coming from the disorder or they're coming from a medication. And because we have many different kinds of antidepressants available, very many times we clinicians are able to help our patients. So maybe, Adam, you could do this because you have been so open about this issue. If I were to ask you to give advice to a fellow patient who's uncomfortable talking about their sexual difficulties or sexual side effects, could you perhaps give some advice on how they can overcome their reticence and bring up this topic with their clinician?
So my main advice is just your clinician is there to help you, and your clinician is not there to judge you. It's about being open. They're there to help you with all the issues that you're dealing with. And I'm really glad that I was able to open up because it helped me realize that nothing that I was experiencing was my fault, and I wasn't broken. There wasn't anything wrong with me. So being able to have the open communication was the way that I was able to navigate that path, and it helped. We got over the hills and valleys together. We climbed each fence, and we eventually found out the medication that was correct for me. Within society, as I've seen it, I feel like a lot of people are just apprehensive to talk, not even just to their clinician, but in general about any mental health issue, because it's so heavily stigmatized. And it's this weird thing where it's like, you can't talk about it because of the stigma. And also like, it's not manly to have this. It's important to destigmatize that, and also just to destigmatize sexual issues. The odds that you're the only person going through this is so small. There are so many people also going through this. And by knowing that this can happen, and that depression happens and sexual issues happen, and they can coexist, knowing that it can make it easier for you to talk to your doctor because there are solutions available. But I also want to be very clear that, like most things, this is obviously easier said than done.
Mm-hmm.
It's not something that I believe that everybody's going to be able to do on the first step. And that's also okay. It's hard. I don't want anyone to listen to this podcast and feel like, well, if I can't bring it up, no. It's hard. It's difficult. But I promise you, whoever is listening, that bringing it up is going to end up bringing about results. And it's going to just, from my personal experience, improve what you're dealing with. And having depression is no different than somebody having diabetes and needing insulin. You're just regulating something. And again, like we said, side effects can happen with any medication that somebody takes. And I know it adds an extra tricky layer when you're talking about a mental health medication also affecting a sexual issue, because those are two very stigmatized topics. So as I was talking to my doctor, it made me realize that this wasn't my fault and that there wasn't anything wrong with me. This is just something, and these are things that can happen when you're living with depression or you're taking medication for depression. It's not your fault. It's just something that's going on that you just have to figure out, which luckily helped me open up to sort of go through the whole path of everything, which I guess led me here today. So I'm very thankful for that.
What an empowering message you are sharing, Adam. Really, it's quite empowering. I am certain as people are listening to you, they are appreciating that talking about sexual difficulties, if they do occur, in the sacred context of a patient-doctor relationship is completely okay. That's where one should feel comfortable discussing such complicated issues, especially because that problem very often can be solved. So, Adam, not only did you empower individuals, in my opinion, I think you gave them a path forward on how they can bring up such issues. So I want to ask you this. Have you had any negative experiences in this particular issue or anything else when you are dealing with a clinician?
I only had one very stark negative experience. You fill out a questionnaire and they match you with a doctor. And I personally have always been way more comfortable talking to female doctors. I don't know why. I guess I just feel more comfortable. But they paired me with a male doctor. I'm like, you know what? Fine. I answer the questions. Like, let's give this a shot. So the way that he went about it was just sort of something I wasn't comfortable with. And it just wasn't something that worked for me. Now, I do want to say, I don't believe that this is an indictment of that specific clinician. Just because we didn't match up in what I was looking for in a treatment plan and what he was giving me in a treatment plan, it doesn't mean that this person was bad at their job. It's just sometimes your doctor and you aren't going to be the right match. You just need to find somebody that works more for what you're looking for in a treatment plan.
That's excellent. That's great advice, Adam. That really is good advice, because now that we are aware, thanks to you and thanks to the data we have in the medical community, that both depression and medications we often use to treat depression can create sexual difficulties, Adam is giving us a path forward. And that path forward is, don't keep it to yourself. Bring it up to your clinician, because we clinicians really do have training in trying to separate the two issues and then be able to guide you in the right direction. But I think, Adam, you would agree with me on the statement I'm about to make, which is, dear patient, don't stop taking your medication or just live with your side effects. Would you agree with that statement?
Yes, I fully believe that you should be open, trust your doctor and yourself, and remembering that you're not the only one experiencing this. Take your medication and just be open and honest with your doctor. You two can figure it out together. That's what they're for. That's what you're there for. And just talk and be open, because they're there to help and they can help and they will help you, as long as you're just willing to discuss and be open and just go on the journey together.
Adam, thank you for that vote of confidence in my profession. We really do want to help individuals. So much good advice you gave our listeners. And because everyone is different and everyone who's living with depression can have different symptoms, it is really important to create the kind of partnership that Adam and I are recommending. And we agree sexual difficulties may be even more difficult to bring up, but Adam is giving us a very good path forward on how to be your own advocate and how to involve the clinician in looking for a solution to this difficulty. Living with sexual difficulties is not something you ought to put up with. And talking it over with your clinician as a team, very likely it is going to lead to a resolution up to the difficulties and improve the quality of life, as I know Adam is saying, and so many of my other patients say. So Adam, I really want to thank you for your incredible honesty and your eloquence. Thank you so much for joining us today. I really enjoyed our talk, and I so appreciate you sharing your story and being so open and honest.
I enjoyed it too. Thank you so much for having me. I hope that everyone takes something with them and it will help at least one person on their journey. So thank you so much. I really appreciate it.
Adam, I don't think it's going to be one person. I think it's going to be hundreds, if not thousands of people who will listen to your message of hope and your story of empowerment. And I thank you very much. And I also thank all our listeners for listening to us today. Goodbye for now.